And she actually is qualified to practice District 9213. Can you please clap for the district governor? Thank you very much, Mr. Governor. Allow me also to invite you in leading us in these 7 months of his year.
Sometimes most of the mental health issues are not handled early in life. And I also want to say that early prevention is regarded as a sustainable and probably also cost-effective method to reduce the burden of mental disorders, especially in low-income countries where resources for care for mental disorders are low. This is according to research done by someone called Thuman. Yes, every time we handle, they said that prevention is better than cure, yes? So every time something is handled at its earliest point, we save a lot. You know, we save a lot than waiting when someone is sick and then they have to go to be institutionalized. That means the government will spend a lot of money, the family will spend a lot of money, and when it comes to mental health, I think most of the work is kind of low left for the government, and sometimes the resources are not even there. But for now, what is the status of school counseling? Yeah, talking about schools and mental health. Do we have counseling in schools? It could be a yes, but is it as effective as it should be? Is there mental health awareness deep in our schools, in our tertiary institutions? I want to also say that currently we are still benchmarking on the Centers Akajubi report of 1962. That is, Minister of Education is still benchmarking on that, and I'm happy that a Minister of Education official is also here. And the CASO Review Commission of 1992, which recommended guidance and counseling in schools. And in 2008, Minister of Education established a fully fledged guidance and counseling department at the ministry. And I think I've seen that office because I said I was a teacher. I've ever been there and seen it. So this, however, this was to handle issues concerning HIV and AIDS at that time, and some psychosocial concerns, and then career guidance. So that is I will not give you all the details of the Centers report, but that was the aim, to avail some psychosocial support in schools. However, unfortunately, when HIV peaked, counseling was more towards HIV. And that's why even today, when we speak about counseling, people will first rise and say, okay, these are HIV counselors, because at that time there was HIV and they needed to psychoeducate young people and adolescents about the problem. So currently, schools hire counselors to come and speak to children about mental health issues. However, this is done usually on a day. Like, for example, they will hire me as a counselor, and I go to a school, and then I find when they've arranged for me about 500 children, me one counselor, to speak to them. And when you speak to these children, in most cases, when you're about to leave, remember you're one counselor, out of 500 children, there will be about 15 children who want an individual session, and they are all having burning issues. You know, someone says, can I speak to you? Can I speak to you? And then you're like, okay, how am I going to handle? Then you allow yourself, let me only see 2 people. So as you are beginning to see one child, a child opens up a story, and you're like, okay, am I ready to do this at this time? The child is telling you, I'm sorry, I will have to say this, as the good thing I'll not mention the children, but then the child says, I have a problem. My brother-in-law uses midsection every holiday, and my sister does not know, and I fear telling her, and I'm sick and tired of this thing. But if I say, my sister will chase me, and my education will stop here. As a counselor, what do I do at that time? My time is over. I've been called to address 500 school children, and I'm about to be out in 1 hour. And I get stuck with this case. And you know, you'll not just rush with the case. The child is trusting you. They usually don't trust their teachers because they think the teachers will what? Will tell out their stories, you see? So those are some of the issues that we'll discuss later. Then children express the need for counseling, but most cases this is not met since the schools can only afford a one-time group counseling once in a while. A few schools here and there have some counselors in their schools. Then the COVID era, much as we seem to be away from it, it had exposed many children to trauma and issues of grief. I think children faced a lot of grief after COVID, and they do not, adolescents and young children do not know how to deal with grief. These are things that affect them emotionally and then go ahead to affect their academic life and their social life. And so for children who are suffering anxiety issues, both physical, emotional, because they had suffered emotional abuse, physical abuse during COVID era. Like, because we are counselors, this is our work on a daily. So we met these children. You meet a child and they tell you, our neighbor, when my parents had gone away, told me to come to his house and take him this and this and lock the house. You know, those are the stories we could hear, especially during stigma, discrimination, teenage pregnancies. These are all things that had already been there but only worsened. And if we also now benchmark on our sustainable development goals, 3 and 4, still the target is to have good health, which includes mental health, and also quality education. And then similarly, mental and psychosocial well-being are important for children's education, and because it helps in things like attendance rates. For us who have taught in secondary schools, you'd realize that some children keep missing school. But usually as a teacher, I'm not trained as a psychologist, I'm doing my work. I only do the best, my best by saying, Betty present, Peter absent, so present, absent, and then I take the register to the school headmaster. Usually there is no follow-up to know what could be happening to this child. Okay? So the child comes back, sometimes they are punished for missing school, for missing notes. As a counselor, the day you visit the school, that is when the child will open up and pour a lot of tears and say, you know what, I was home, my parents could not pay school fees. You know, my mom and dad separated, and therefore when mom asks for fees, dad says, you know, all those things. These things are being handled by a teenager who's about 14. They do not know how to tell the teacher that, you know, we have issues in my family. They'll keep quiet. The teacher is saying, you miss school. They are being, you know, they are being stereotyped for being absentees. So what kind of adolescent is this going to be? What kind of adult? That's why we have people who have, I don't know a better word, but people who are usually very rude, tough, you know. They are so highly defensive because they've not had people who listen to them and feel for them earlier on in life. So mental health, like I said, is an integral component of health and well-being. It will influence academic, social, and even economic outcomes of one's lifespan. So there is no way we can throw this aside anymore. And good mental health means being better to interact with others, function well, cope, and thrive. It is generally basic human right to have good mental health, and therefore it's a human right. Then it should be extended down as low as primary schools, secondary schools, and even up to tertiary institutions. Mental health exists on a complex continuum, we know that. And usually people have experiences ranging from optimal state. Sometimes we are fine. Everything can look like it's good, you're in the green. But sometimes one can experience some mild to moderate depressive state of life. But some people can go to the extreme of the continuum, and those ones need to be rehabilitated in a hospital or need to be under medication by the doctors, and then they're also supported by the psychologists to be able to cope with their issues. So mental health should be treated the same way we treat physical health. So education is a protective factor, is one thing I had mentioned here. For some children, school is a heaven. It's a place where they feel safer sometimes more than their homes. So if schools can be equipped to address children and adolescents' mental health and psychosocial well-being. We are sure that we'll have better young and older adults because currently I work with young adults, I should say, because they're in the university. These are between 18 to 25 years. But then when a 22-year-old person comes to you and then you think you're going to work on a current issue. For example, they're going to say, you see, I'm doing this course, but I do not like it. You realize when you go deep into their issues, they'll tell you, see, this issue started when I was 12 years at home. And then you're like, okay, now, this has never been worked on. So people carry on childhood trauma, childhood adverse effects into adulthood. So if this can be brought as low as possible, so that just like we did, I did not do chemistry at A-level sciences, but at least in primary we're introduced to basic sciences. Yeah, we did basic sciences. So I don't think I'll be so much off when you ask me something in biology. I know that I should wash my hands because germs will do this and that, and then I'll get an infection. I have basic knowledge. Why can't we also have basic knowledge in mental health issues as young as primary? Why can't we integrate mental health in primary school, in secondary school, so that by the time someone is 25, they know that when I'm sad, I need to listen to my heart and remember, oh, my girlfriend has chucked me, and of course I'm getting effects of grief, of loss, and let me be ready for this. I'm going to feel bad, and I think if it's worse, I need to go and speak to Evelyn, or I can speak to a confidant, and I now feel bad for some time, so that someone is aware. Otherwise, someone, the first thing says, yesterday my client told me that I did not sleep. This is an adult client of about 40 years. I did not sleep yesterday. And one of the things is, one, I wanted to kill myself. It was highly suicidal. But then I said, why should I kill myself? I need to kill the person who is bringing this issue to me. And this is his girlfriend, who they have a child, because this person is refusing him to access his child. So he feels if he kills the girlfriend, at least he will be the only one to be with his child. You see? So if people have the basics and know that some of these things will take me to the extreme, I need to speak to someone before I do something so bad, you know? It's very important. Furthermore, the school itself is a place where children's mental health can be strengthened, for example, by encouraging a help-seeking behavior. So meaning if we roll out mental health into schools, we'll have our teachers given some basic knowledge whereby they can be able to identify that this child needs further help. They can be able to have this other ear of being able to listen and stereotype. In schools, teachers are too busy, they work a lot, and also because of maybe the pay, sometimes they also have their own stress. So also the caretakers, the teachers as well need to be taken care of. Positive mental health translates into good behavior, good habits, and if all schools produce students with a fair mental health, we would have positive mental health in our adulthood. Even when we face, like we say, these stressors will always be there. But can we be able to cope with some of them? And can we realize that now I'm at the extreme end of the continuum, I can't handle it? Remember that schools are hosting children at the most vulnerable ages. There are these young ones in primary, those ones are young. They may not have yet very many emotional, but from around 10 years, children's emotions begin changing. So look at a teenager, someone who is about 12 years. And those ones in high school in particular, it involves a transition in physical, emotional, and social maturity. During this period, a person goes through very big issues in their life. They are worried of their own physical changes. They are now having emotional, they are now beginning to wonder, when that boy looks at me, does he like me? Am I as beautiful as other girls? Am I handsome? Because, you know, those worries, they are small to us, the adults, yeah? But they are very big to the children. So they are already going through their own internal wars. So it is the time when young people are most vulnerable to stress and they are in need of support, and yet they are the ones who do not access. My fellow counselors who are online and those in the mental health arena who are here, you can really I think you've met such cases as you interact with young people, maybe in your community, maybe also in the church, okay? So issues with identity crisis at this age, for example, when a teenager fails to resonate with themselves and to know more about their future, it will result into defiant behavior. You know, there are those children who are defiant. You know, this child who is expelled from school A, school B, school C, and schools keep expelling. No one ever sits down and says, well, what is the real issue with this child? Okay? So sometimes they expel and then the story goes along. You see that child was expelled from here and there, expelled from here and there. But what is the underlying issue? Could it be a family issue? And by the way, parents here, let us know that most of the mental health issues that our children face come from our homes. They are very much attached from how we relate as family, as couples, as neighbors, as the community, as the church. Most of the things come direct. So let us not throw away all the responsibility to only the teachers and other academicians. So academic pressure comes from ambitious academic goals. Sometimes I meet people who are doing these good courses in quotes. These days things are changing. We are having other things on board like IT and so on. But for us, when we're growing, when someone says, I'm doing medicine, said this is top notch, engineering. But then you see someone is coming from medical school and then is in 4th year and is telling you, you know what, I want to quit the course. And the parent is home saying, wow, my son is finishing medicine and I'm so happy, I can't wait for the graduation. And the boy is saying, I'm dropping out. And when you go, there are so difficult issues that have been on and on and on and on and not worked on. And someone drops out without finishing medical school. And not that, by the way, I'm speaking about people who are even on government. I'm not speaking about people you say, that one was they just pushed them. You realize, I go back, we counselors and mental health people, we go back into childhood. This person got 4 in P7, 18.8, in senior 6, quadruple A, but they are pulling out of the course. They are pulling out of engineering. They are pulling out of those prestigious courses that you know about, mental health. So, just to try to wrap up, so here I was saying that, so adverse childhood effects are so common among growing children in Africa. Why? Due to poverty. And of course, we live with extended families. Sometimes we do not know that the aunties and the uncles, the maids, the what, who are in our families are also somehow affecting the children because we don't have time. Why do we call them neurodevelopmental disorders? It's because they begin early while the brain is developing. And they are disorders that affect the day-to-day behaviors, the day-to-day thinking, the day-to-day. So these disorders present with deficits. Now, the name in ADHD tells it all, that attention deficit. It's something that is not there, and therefore it becomes a little more difficult for the community to identify that this person has limited attention and concentration, because you need to be able to know what is generally, understand what is normal, and then you can be able to tell this person has a limited or a deficit in attention. But in most cases, they are taken as, especially for attention deficit hyperactivity disorder, they are taken as behavioral or bad behavior. If a child can't sit still during class, yes? If they are disturbing others, if they're always asking, can I go out? Can I go out, teacher? Can I go out? And they prefer to be out, and they are disorganized, they are losing their pencils, they are losing their bags, they are not doing homework, they end up being punished. Both parents
and the teachers. And by the time, and it's those punishments that then create the mental health issues that the keynote speaker was talking about. And in that case, the main problem, much as you can address the mental health issues that will come, the child will now begin to shy away, they can get depressed, they can become anxious. The ADHD has to be diagnosed and it has to be treated. The unfortunate bit of it is that now we are seeing adults who have gone through life in their childhood, adolescence, with the ADHD, and now they come as adults, completely disorganized, using substances to cope, can't hold down jobs, can't hold down relationships, and now we have to go back and treat the ADHD. For autism, it is also a neurodevelopmental disorder that affects social interaction and social communication. Again, there are deficits in social interaction and deficits in skills in social interaction and social communication. So it is around how human beings communicate verbally and non-verbally. Some subtle things like eye contact, the distance you stand away from the individual when you speak, the way you relate, they're really subtle, and therefore when they are mild and moderate, it's usually difficult to pick from the community. But also the way we are brought up. We are brought up in such a way that some things that are not there, we are encouraged to live within our means. If a child is not able to talk or talk properly, and the parents go out to find out what is happening to my child, the relatives, the neighbor will say, don't worry. Even the other child delayed, it's okay. You know, so they keep on delaying until by the time they come, the child is 10 years, 6 years, without speech, without learning skills of social communication and social interaction. And of course, there are some other symptoms that when we put them together, then we can make a diagnosis of autism.
When we talk about mental health, this is so big an elephant to be carried by one person really. But as you are aware, for teachers and for schools, for learning to take place, then health is very critical. But we can't teach health learners or presume without really addressing the mental health. So there is no health without mental health really. And the question is raised to me before I directly come to them. The Ministry of Education, the COVID accelerated the rates, and the ministry had to come out on what Dr. Bo had just shared. Last year, the Department of Guidance and Counseling documented about 20 cases of suicide among learners between the ages of 6 and 23. From 6 years, the majority of them were in Wakiso. Wakiso, because of maybe the geographical location of Wakiso. These are cases, learners committing suicide, successful ones, for a number of reasons. So when Rotary comes up, support us as government, as the education sector, we are really very grateful. Accept our appreciations. When we talk about these issues, how can teachers tell? It is so a question which might not have a direct answer. But I would say that because of what I have earlier shared, In September of last year, the ministry issued a circular to schools calling upon them to prioritize mental health. As you are aware and you agree with me, a number of teachers have issues and you can't give what you don't have. So themselves, they have issues. And in a number of instances, some people tend to focus on the runners, forgetting the teachers. So teachers themselves, the majority of them are incapacitated. They can't tell. When we worked out our work plan for implementation of mental health interventions, which I have shared with Julian, one of the issues is building capacity. We are saying, can teachers working with the partners like Rotary be trained to identify mental health issues, challenges among themselves, among peers, but also among learners, as one of the key components that we need to address. How to integrate, I have already talked about it. And the teachers, there is a very big gap. Because as my colleague, the secretary, in the keynote alluded to it, a number of them did some basics of counseling. They are not counselors. So they can't do much. There is a very big gap in terms of capacity, but this is where we need your support to ensure that the different stakeholders are brought on board. The parents, a number of these mental health issues we are talking about are coming from homes and communities. The pressure, the demand for them to perform, the domestic violence at homes, all these have a bearing on the mental well-being of a runner. When we conducted the gender and well-being assessment last year, 2022, one of the issues that came out was the mental deficiencies, the psychosocial needs of the children in a number of schools. The reopening of schools, the teachers with the demands from parents are telling learners to perform academically because they have to compensate for lost time. I don't know how lost the lost time is. Time to play and developing the cognitive abilities of the learners is hardly given attention to, with the exception of the few schools. In an attempt to do so, we hope to work closely with the districts. Government has approved the creation of the guidance and counseling officer in the district within the education department. There is a person now in charge of guidance and counseling. So we hope to work closely with these people to ensure that we reach out to the communities, but also we are talking about now the multi-sectoral approach. Education closely working with the Ministry of Health, closely working with the Ministry of Gender, Labor and Social Development, and local government to ensure that some of these packages are taken because we have the same target population. We are also looking forward this year to roll out the life skills toolkit, which the ministry launched later last year, so that a number of the issues we are talking about, as it has been shared, it is about the individual being able to cope up with the challenges or the demands of life. So the life skills toolkit will help us in a long way in addressing these issues. Also, as the education sector, in 2020, we launched the guidelines for senior women and senior men teachers in schools. This is a position that has been there. They do part of the psychosocial support within the school system. So we are closely looking at enhancing their capacity to be able to identify some of the children or staff that could be having these issues. We have already developed our work plan, which we are sharing with the different partners, because we either act now or never. Mental health issues are on the rise. Children are taking drugs. Girls are sneaking substances into schools. They are packing them in sanitary pads because teachers rarely check these ones. They are having issues, and the time is now to act. Mental health is no longer an issue. We should keep quiet. As they mentioned, just emphasis. In schools, depression is very common, and it is the highest among girls as compared to boys. When you look at cases of suicide, as of last year, the majority of them were girls. There are few cases of boys. We are having accelerated stress in schools. We are having anxiety in schools. These are issues as we plan to go out, reach out to schools, where we will be implementing. We need to join our hands to ensure that we address this. Otherwise, there will be no learning without mental health. But also, we must be aware that there is a lot of stigma associated with mental health, actually mental illness. Many people look at it negatively, but we must stand firm and help all those around us. Because walking in the rain doesn't make you to become rain. So having a mental illness doesn't make you to become mentally ill. So the Ministry of Health has a mental health policy, but also in 2018, 2016, they passed the Mental Health Act. So if they pass the Mental Health Act, that provides for all of this. Now the Ministry of Health has the mandate over all the health issues. But as you are aware, more than half of Uganda's population are younger people, and they're in schools. So health has to work with schools to ensure that this is implemented. Now that the Minister of Education issued a circular, which Julian will share, I have already shared with her this circular about mental health, even the other one on the state of mental health. We are moving forward now, education, to work closely with the health to ensure that these needs are addressed. One of the things proposed in this circular is calling upon schools to allocate 1% of their budgets to mental health interventionists, but it also talks about making use of either psychologists where they can, depending on the budget of the school, so that these issues are addressed. But we're also looking at how do we create leakages and referral for complicated cases that can't be handled at the school level. So this is what we are looking at, because education alone, this is too big an elephant to be carried by one person. Thank you very much.
So when you talk of now, actually now is rather late, but it is never too late to get started. Ordinarily, we should have started yesterday or the other day. But even when we start today, it is good enough. So why now? Because we are late and we should begin now. This very meeting is the best thing that has happened regarding this kind of intervention. So the issue is so broad, is so apparent, and we need to act as Rotary. You'll appreciate that our new vision statement as Rotary is that together we see a world where people unite and take action to cause lasting change across the globe, in our communities and in ourselves. Today we've come together, we've united, and we are taking action to cause that lasting change of engaging the challenge of mental health. I'm wondering, because statistics are clear that every collection of people you have quite a good number have mental issues. I'm wondering how many of us in this room have issues. And we should begin with ourselves, because the degree matters. We have...
DJ was fearing to ask that question.
Yeah, because across the room, you'll find that many of us are getting these challenges at various degrees. So it is an elephant in the room, and we need to engage it. So as Rotary, we operate at 2 levels. What we need to do now is to build a critical mass of clubs in Uganda to take this as part of their agenda. We already have 7 of them that have, we've got several of them that have started and are in this room. So as a district, it is to mainstream this engagement and ensure that each and every club has an activity to do with the mental health. Already, we have the basic education and literacy enhancement program, which begins at the very basic level. As of now, we are working with over 500 schools by all the clubs in District 9213. We need to extend it to the entire Uganda, so that we begin with those very schools that we have interventions in as we work towards expanding the outreach. So that is the first point of call. Let each and every club pick interest and design a model of engagement with the schools in the communities where they do serve. The second level of intervention is at the community level, because we have learners in schools, but we also have young children who have no opportunity to go to school, and they may be suffering from the same. In the spirit of inclusivity, we need to reach them out as well. So let's also engage the communities where we do operate. We do have projects in various communities. Even when we don't have school projects in those communities, let's engage the stakeholders in the communities where we do operate and be able to address this ill and challenge in the communities. We need to identify stakeholders. Already some good work has been done in this area. We've got the experts, we've got the ministries, departments, and agencies of government that are relevant to this initiative. We need stakeholders of government and non-state actors like NGOs and other organizations that have an interest in mental health, so that we build rapport and we create a critical mass of engagement across the spectrum. We need to have partnerships created and be able to engage at different levels with all the stakeholders. So we need to get all the stakeholders on board. We need to identify them. We need to collaborate with them. We need to cooperate with them. We need to coordinate with them. We need to consult them. And we need to communicate around the community. But most importantly, we need to build capacity within the Rotary fraternity in terms of the basic knowledge and the basic information, so that each and every Rotarian can be able to engage at individual level, beginning with our families, because the challenge begins at the family level. As Rotarians, we need to engage our families, both nuclear family, immediate family, and extended family. And we need to take it to the community. As Rotarians, we are part of the community. Are we addressing our neighbors regarding this subject matter? Are we addressing the church where we go? Are we addressing the neighborhood where we are? Are we talking about this subject when we talk to our OBs and OGs? Are we talking about this subject matter at the place of work? Are we talking about this subject matter to our friends? So as Rotary, we need to come out and create visibility over this subject matter. We need to engage, we need to be available and willing to share. But we want to do it from a point of knowledge. Thank God we've got the experts with us. We need you as experts to share with us literature so that we are able to communicate on the basis of facts, on the basis of knowledge and right information. Otherwise, we may create contradictions if we are sharing wrong information and wrong awareness messages. So we need to be empowered. We are willing, we are many of us. We have Rotarians, we have Rotractors, we have clubs across the country. We want to have them empowered so that this information is shared with all the clubs and we create a critical mass of awareness creation.
Coping negatively involves some people resort to pornography. We have people who are so addicted to pornography, but because for them that is the way they bring some joy to their lives. They cope with substance, with alcohol, with drugs. You know, these are used as something to hide them from their pain. Then students also encounter low self-esteem, social withdrawals. They have issues with eating disorders, relationship issues. Like I said, it might be small to you, but very big to this child. And due to limited knowledge in mental health, parents and teachers may see symptoms of a student's mental health struggles expressed as a decline in school performance, poor grades, despite strong efforts, or repeated refusal to go to school, or even refusal to take part in normal activities. So the parent or teacher may not go further than that because they may think this child is just having issues. I've already given you many examples. As what should be done, I'll start with maybe Uganda Counseling Association. What have we tried to do currently? One Uganda Counseling Association has the mandate and is committed to ensuring professional counseling is embraced everywhere. Professional meaning, why? Because we've gone to schools and when we speak about counseling, the head teachers tell us that, but our teachers are counselors. I was a teacher, but I was not a counselor. And I remember children would come to me with issues. Yes, I would do the good job of listening, but I may be limited on how to handle certain cases. But a teacher is a good person to be given skills to be able to identify and maybe say this case needs a psychiatrist, maybe this case I need to send to a psychologist, to a counselor, all those things. So we need that knowledge so that people are totally not aware of what to do. So that's why we take the profession takes care of that. So in addition to professional registration for counselors, it provides periodic training and capacity building and supervision plus mentorship sessions to ensure professionalism is in check. If professionalism is not in check, that's why we'll have issues with children who are damaged. You know, the child tells someone a story and then maybe someone else tells it out, and that's why the children will not come back to say their stories because they feel they are being used by teachers to stereotype them. So we also participated in the Education Review Commission from the public to give views and proposals to be done differently in order to make education become a good catalyst for socio-economic transformation. And in regard to the Senteza Kajubi report, to be able to differentiate between guidance and then counseling. Guidance is information giving, yeah? Counseling is a therapeutic talk. The two are different. But sometimes schools will tell you, we have guidance, we have career guidance teachers. A career is different. You're helping someone to know about a career path. Counseling is a therapeutic talk. So to be able to differentiate all this, yeah, we need professionalism into mental health. And let me just go to my last slide. Lessons learned. During this time, we've learned that young people from the age of about 12 to 25 thrive better with both social and psychological support systems and quality of parenting. So meaning in this, we have to think about the parents, the community, we need to involve parents, the community, the teachers, everyone who is dealing with young people, caregivers, they all need to be given knowledge about mental health. They are at their most vulnerable age and therefore have limited problem-solving skills. So when you see a 16-year-old doing something and then you say, you're too big for nothing, a 16-year-old might be physically big, but the brain is still just developing and therefore is liable to making very many mistakes, okay, in life, and therefore they need a lot of support. Less knowledge about the importance of counseling and mental health hinders the help-seeking behavior. And then dysfunctional families are a leading cause in mental health issues among children.
The common mental health issues in schools. From practical point of view, because I'm a practitioner, but also I visit some schools and I volunteer as a mental health professional to see children in adolescents in secondary school. Anxiety is very, very common. The unfortunate bit of it is that it is not identified, or they present in different forms and in physical forms. For example, an adolescent may have a panic attack just before an exam, and it might present like something else, like a fever or something else, and therefore it would be missed out. Many other circumstances lead children to be anxious while they're in school. They worry a lot about their parents because they take time without seeing them, particularly during the COVID period where visitation was cancelled. It caused a lot of anxiety in the young people. Second to anxiety is depression. Depression is so common, and those two conditions are related neurobiologically. And depression may present as in young people as lack of sleep, but also sleeping too much. It may present with withdrawal. It may present with losing interest in activities that the young person used to engage in. And it may also present with the extremes of it, suicidal thoughts. There is a belief that young people, children and young people do not have much problems and therefore they should not be depressed. But actually, as you've heard from the keynote address, a lot of issues from the environment in which the young person is growing up, home, school, the community, the churches, these are the issues that cause a lot of psychosocial distress in the young people. The other one that is also related to depression are suicidality or suicidal tendencies. We are seeing this increasing, and it occurs in different forms. But the one that really makes the community or the school wake up is when the adolescent or the young person actually attempts suicide. And some of them complete or die by suicide.
We took it on as Rotary and as Chwatule just because we have seen a lot of issues within the media, having a lot of suicidal stories, and COVID brought this issue into existence. It magnified it. So with this problem, we said as a club, what can we do? There's something that we need to do. So we had an initial plan to create awareness that you don't need to die alone. You don't have to suffer alone. We need to create awareness like how you've seen in developed countries. It is very normal to seek help. So we wanted to start this campaign to ensure that we can create as much awareness to the mental health. We share out information, what are some of these issues around mental health, and how can we all be involved. So we have a very good different members within the club, within Rotary, that come from different sectors, in the private sector, in the justice system. We have those who are in the education, and all these. We even have Rotarians who are out of the country that we can leverage on. So we said, let's start on this, and mainly in schools. Why we chose schools? We see that now schools really a focus. This is a young nation with a big number of children within the schools who are adolescents, and most of them are even our children. So what can we collectively do? How can we support the government? How can we support all these institutions? Butabika, as you have seen, is on board. It is only our regional referral, and everyone is going to Butabika. But before you go to Butabika, what can we do? And this is now when Rotary comes in. What can we do before that problem is too big for you to go to Butabika? So we want to leverage on everyone's strength, everyone's power, and everyone to do something. So this is what we have done today. Today we have launched it, we have shared it out, and our next step as a club, as Rotary, is now to start engaging with the schools. We have a number of activities within the schools, and so the next step is to have this awareness go in. We want to empower the teachers so that they can manage these issues within the school together with Ministry of Education, as you have seen, and also the children themselves to be empowered. We are also going to run a series of awareness topics on different topics, anxiety, issues on how to manage drug abuse, homosexuality in schools. We are going to, in the next 2 months, we are going to be running these topics in details, and what can we do. So we are going to have a lot of specialists and a lot of stories. We even have those who have recovered. So all these campaigns are going to run for the next 2 months so that we can empower ourselves, our children, and everyone, so that we all have a collective action towards fighting this mental health.
And we had some very, very good experts to share with us about the experiences of mental health, mental illness, and health in general. We have seen that the mental illness or mental ill health, the biggest challenge begins from the family. The family setting is one which develops everything. When there are issues with the dad and mom, it directly affects the children. So we're requesting that as parents, we need to see how we can have a mechanism of coping up with the stresses that exist. Then we should also have some time for our children, have some time for the family where we sit, not being too busy to come home, not being too busy to communicate. Let's have an environment of communication with our children and with the family members at home before issues relate to schools and to the communities. We find out that even the teachers in the schools, they need some basic of mental health information and the package. So I request head teachers and directors and all the schools, let's have some basic information about the mental health, mental illness, and generally at large. And then lastly, the Ministry of Education and Sports, our request is kind of come up with a policy to handle mental health related issues before it escalates badly. With that, if you come up with a policy, it goes into the primary schools, the policy in secondary schools, in universities, it will curb all those will be mental health related challenges. So kindly, let's do that at the earliest, because mental illness is becoming a very big challenge as we get along.
We thought about this initiative some time back when there were very many cases of students and kids in schools committing suicide, and others running away from school, others being on drugs and all. So we thought that Rotary has been doing a lot of things in terms of health. We've done cancer, you've heard about the cancer run. We've done the blood donations, you heard about the Mengo Blood Bank. You've seen us doing family health days where we give free medicine. But it has never occurred to us that why don't we also bring on board mental health? So this year, my Rotary Club one of the focuses was mental health. Mental health lies under our focus. We have 7 focus areas in Rotary, and one of them is disease treatment and prevention, but also illiteracy and education. And then we said, if we can bring the school component and the health component together, then we can address mental health. So this year we said, let us kickstart it by having a dialogue. And the dialogue is to bring certain stakeholders on board. The Uganda Mental Health Association, the Uganda Counseling Association, the Ministry of Education, Ministry of Health, Butabika Hospital, and then Rotary Uganda. And see, if we have a dialogue, what are those pertinent issues that we can bring on board and see that we can deliberate on mental health. Now, if you listen to the discussion happening inside, every question that is coming, they are shooting it to the Ministry of Education. Why? Is that why has it taken us so long to address issues of mental health? In schools, we have nurses, we have wardens, we have counselors. But what are those counselors doing? Talking about HIV, sex education, reproductive health. They're talking about reading well, talking about sleeping well. No one has brought up an issue of what? Of mental health. So that is why we have said, let us bring the stakeholders on board and first engage them and see whether they actually want this and they like it and they can embrace it. And good enough, we've heard that there's even actually a section in Ministry of Education that deals with mental health, which we didn't know. Now, that is how we also got to know it from dialogue. And Ministry of Health, where I actually work, apart from being the president, I work with Ministry of Health as a senior communications officer. We have a whole division of mental health, which we have also captured here to see, leveraging on these stakeholders, how can we tackle the issue of mental health. So we are focusing on three things. First of all, we are going to create awareness in schools about mental health, that people should not have stigma. When I say that you're not mentally stable, they don't say that you're mad. No, you can be depressed. You have anxiety. You can be going through a lot. So anything can happen when it comes to mental health. And we are going to create awareness. We are going to set up, you know those clubs in school that you hear about, HIV club, drama club, whatever club. Want to have a mental health club where children can go in. There's a counselor of mental health there, maybe a teacher who has been trained, go in there and they share their ideas. So that is why we have this dialogue and we decided to embark on the mental health program.
So ladies and gentlemen, we are going to count down to 0 and then we shall officially, we have it twice and I wouldn't which popped, but you will